So thank you for joining us for today's discussion about telemedicine priorities and funding opportunities in a COVID-19 world. My name is Michelle Baker, and I'm a managing director at Signal Group, a modern public affairs firm that works across many sectors, including healthcare, technology, and data privacy. We're co-hosting this today with Wiley, a Washington, D.C. based law firm that has more than 240 attorneys and public policy advisors representing clients in complex, high-stakes regulatory litigation and transactional matters. With me today, via phone, of course, we are all social distancing, are our two partners with Wiley's telecom, media, and technology practice. Dwayne Poza has expertise in advising companies on emerging tech regulation and privacy compliance and risk management. And Sean Chang builds on his time as a chief counsel in the U.S. House, assisting clients with communications and technology issues. During today's webinar, we welcome you to post questions in the Zoom platform, or you can send them directly to our email addresses, which are going to be listed in the last slide. We're going to do our best to address any questions or comments at the end of today's webinar, or even an email afterwards. We might even use it as a topic for a future webinar, as we do hope this will be part of an ongoing series moving forward about COVID-19 and telehealth. Also, we are going to be compiling a telehealth toolkit. So if you would like to get on the email distribution list for that, please feel free to send an email and we'll make sure to add you to that distribution list. Coronavirus, or COVID-19, has disrupted lives and economies worldwide, as we all know. During this pandemic, we're facing challenge and disruptions about how we work, how we shop, how we learn, how we socialize, and importantly, how we get healthcare. Going to the doctor itself has become a health hazard, with people homesick, often scared, and desperately seeking medical guidance. At this key time, telemedicine or telehealth has emerged as a tool to help prevent and stem the spread of COVID-19. With this pandemic, we're seeing a surge in demand for on-demand care and in record numbers. In fact, some have estimated that right now, the majority of patient consultations in the United States are actually happening virtually. Talk about a shift. Physicians who previously avoided telehealth altogether, dismissed it, are now reliant on it to keep their practices afloat and manage their patients' care. Health systems who had featured telemedicine prominently in ad campaigns, but still had services that were had low utilization rates, they're now scrambling to staff up and managing a really heavy virtual visit load. In addition, patients who were reluctant to even try telemedicine are scrambling now trying to figure out how to schedule virtual appointments for their entire household in many instances. And the federal government, having long touted telemedicine as a panacea for things like physician shortages, rural care challenges, high costs, and access issues, they're breaking down some significant and longstanding barriers to delivering virtual care. And at mass scale. For example, the state and federal regulations have become more flexible as limits on scope of practice, covered conditions, site of service, and many other parameters have relaxed. Also, the CMS expansion of reimbursement for telehealth services is really key at this time. But even better than that, many federal agencies are putting real money and behind programs to help equip new entrants to the telehealth space, or to shore up existing telemed programs and platforms so that we can provide high quality, safe telemedicine services, not only now, but in the future. Now, the main reason, the federal government is putting all these resources into telehealth is obviously the immediate needs that are stemming from this pandemic. Telehealth is central to the COVID-19 outbreak response system. It's helping to stem the tide of the virus, protecting both our healthcare workers on the front lines, as well as the mass population overall. We've heard a lot about social distancing, but medical distancing is key, with telehealth allowing healthcare providers to triage patients with cold or flu-like symptoms, screening them virtually versus having them enter their offices or hospitals, And if you think about that, if every infected person is expected to infect 2 to 3 additional people, telehealth really helps reduce the risk to keep, patients and healthcare providers on the front lines safer. And telemedicine has really fueled some pretty innovative thinking on the healthcare delivery front lines. We're seeing physician practices setting up drive-through screenings and outdoor testing tents and centers. In fact, the major barrier for physicians right now who are trying to make coronavirus diagnoses or figure out a plan of treatment, the main barrier has been access to tests, not access to the patients themselves. Some COVID patients, once diagnosed and are trying to leave the hospital, they maybe leave with remote digital thermometers attached to their fingers, and that provides remote physicians with real-time information about, temperature levels, blood pressure, oxygen levels, things that are really important. Electronic ICUs are set up, allowing nurses and physicians to, remotely monitoring as many as 100 patients simultaneously who may be in, very different hospital locations or sometimes even regions. Community paramedicine units are going into homes and providing testing sometimes before bringing hospitals back to the patients. So that allows a positive patient to bypass the ER or go through a traditional admissions process where they would be infecting many more people when they entered the hospital. And in fact, in many instances, quarantine doctors are the ones that are providing remote care to patients. That's really essential when you consider in some of the recent cities of outbreak, up to 100 healthcare providers in one hospital might be quarantined. So that's a really important addition to sort of the role that telemedicine is playing right now. And also, although not as immediately evident, remote care is saving lives via mental health telemedicine services. Social distancing has, as you know, isolated patients, and some have very serious mental health issues. And those are exacerbated by the extreme stress and uncertainty of the pandemic itself. And telehealth has been a true lifeline for many patients in need of care for anxiety, depression, a range of mental health issues. So in addition to managing COVID-19, the role that telehealth is planning is also delivering remote care to patients with chronic conditions. In some instances, people are more scared of getting infected at the hospital than they are about getting their chest pain checked out. In fact, after many pandemics or outbreaks, there's a wave of hospital surges for chronic conditions or issues that might have gone unmonitored while people avoided the hospital. And some recent news articles about the low rates of admission for heart attacks or strokes indicate that there might be currently, some public reluctance to seek medical care or emergency care for acute issues. However, some health systems, startups, and physician practices are using telemed during this COVID-19 outbreak to better manage care for patients who might have chronic diseases or very complex care regimens. For example, some diabetes clinics are checking in on patients, glucose monitors with remote readings, and then following up with them directly when the numbers might be off. In addition, people who have hearing aids are sometimes getting remote tests and receiving adjustments remotely to their hearing aids via a healthcare professional connected with them remotely. Cancer treatment centers and oncologists are using telemedicine perhaps to go over a scan together or follow up on how a patient is responding to a new medicine or treatment. HIV centers are using telemedicine to stay in touch with patients on preventive therapy, extending their script cycle so they stay on PrEP. In fact, many HIV centers are even using to check in on patients on things like food supply, housing, and other issues. In addition, the statistics about the impact of the virus on communities of color are startling. Many free clinics and community health centers are starting to use a range of tools to reach underserved populations with texts, calls, or reminders about treatment regimens for high blood pressure or asthma or other chronic conditions that often exacerbate the effects or are often exacerbated by the effects of the virus. Now we're going to talk a little bit more about, federal funding opportunities and some opportunities to help shore up telemedicine practices and opportunities. But we really, as we start to map out the future of telehealth, you really need to think about, the telemedicine strategy for the long haul. As you apply for funding, as you hire providers, market to the public, really think about the long-term effects. For the most part, many of the telemedicine has almost been forced on some unwilling doctors or reluctant doctors, patients that might not have given telehealth a try. But guess what? Many of them are liking it, and they're not going to be in a hurry to head back to a hospital setting or a physician's office in any rush to do that in many instances. So really thinking about how your platform might help bridge the enormous gaps in access to quality care, specifically where there are significant shortages such as mental health. How will your program build on the lessons that we're learning right now in rapid fire? Talking about that and expanding that in your long-term strategy will be important. How will your telemedicine platform better equip us in a global environment where outbreaks of this scale linger or even reoccur? And while it will be important to have face-to-face physician-patient interactions back on schedule, this is certainly going to shift in some way the new dynamic about how people and where people seek medical care. So we're going to talk a little bit about the federal funding streams and some key privacy policy imperatives. To provide a little more detail on what Congress has done to support hospitals, healthcare facilities, and businesses hard hit by COVID-19, I'm going to turn it over to Sean Chang.
Thank you, Michelle. Good afternoon, everyone. So this presentation will be discussing the COVID-19 telehealth program that's administered by the FCC that was created as part of the CARES Act funding, which appropriated $200 million to the FCC to support healthcare providers' use of telehealth services to combat the COVID-19 pandemic. At the same time, there was another $100 million that was approved for the Connected Care pilot program, which is funded separately by the Universal Service Fund program. This presentation won't touch on that, but if you have any more questions, please feel free to reach out to us regarding that pilot program. Now, the $200 million COVID-19 telehealth program is meant to provide immediate funds to eligible healthcare providers responding to the COVID-19 pandemic by fully funding their telecom services, information services, and their devices. The application portal has opened since Monday, April 13th, and the FCC has already announced, actually today, making a third rounds of award announcement, and the total is now roughly $9.5 million spent to 17 entities across 10 states. Next slide, please. The eligibility is crucial here for the telehealth program. The participation is limited to nonprofit and public eligible healthcare providers that fall within the following eight statutorily defined categories, similar to the rural healthcare program. They include post-secondary educational institutions, community health centers, local health departments or agencies, community mental health centers, not-for-profit hospitals, rural health clinics, skilled nursing facilities, or consortia of healthcare providers consisting of one or more entities falling into one of these 7 categories. Unlike the rural healthcare program, the FCC does not impose a rurality requirement on the providers. So it is open to both rural and non-rural providers. And for a consortium to apply, the consortium leader must obtain a letter of agency from each healthcare provider who wish to participate in the program, and they can apply on their behalf. Next slide, please. When it comes to eligible services, the definition leaves it quite broad in terms of what kind of services can be provided. It's basically connected care services that uses broadband-enabled technologies to deliver remote medical services directly to patients. And then there's a cap for up to about $1 million per applicant. The telecom services and broadband connectivity services includes video, voice and internet connectivity services for healthcare providers and their patients. The information services include remote patient monitoring platforms and services that would monitor the patient outcome, and as well as store and forward services, both synchronous transfer and platform and services that's provided for synchronous video consultation. The devices will include tablets, smartphones, or connected devices to receive connected care services. But it's important to know that those devices that's not connected already, that patients use at home, then using that device to share the results with their doctors remotely, those devices will not be covered. The services purchased in response to COVID-19 after March 13th, 2020 will be covered. So the time frame is slightly retroactive to March 13th of this year. And the monthly recurring charges, such as a broadband subscription or the subscription to a remote patient monitoring service, is covered through September 30th, 2020 of this year. Now, it's also important to know that the treatments provided through the services covered by the telehealth program is not limited to COVID-19 patients, but they need to justify how using the COVID-19 telehealth funds could free up resources to treat non-COVID-19 patients, so on and so forth. Next slide. Before you get to apply for the funding, there are several steps that the FCC has helpfully laid out for an eligibility for applicants seeking the funding. First, you should be receiving a eligibility determination from USAC by filling out Form 460. A consortium applicant can fill out Form 460 on behalf of its member healthcare providers as well, if they have a letter of agency from the healthcare provider. For entities that have not worked with the FCC before, you need to obtain a FCC registration number by registering with its core system. And finally, you need to also register with the Federal System for Award Management, or SAM, so that you can receive your reimbursement, your funding. So again, both the eligibility determination and the registration for the SAM system do not conflict with your ability to apply. You can apply at the same time as you are seeking the results from those two other processes. But it is highly advised that you begin the process now, so that you are not being held back by any sort of delays in getting approval or getting a eligibility determination from USAC. Next slide, please. It's also interesting to know that the FCC eliminated the competitive bidding requirement that's applicable to the rural healthcare program under the Universal Service Fund programs. It's not a competitive bidding process, but entities are still strongly urged to purchase cost-effective eligible services and devices. There is still record maintenance requirement for 3 years from the last day of the service. And it also waives the gifts rules to the extent that participating healthcare providers are able to receive gifts or things of value from service providers at over $20, including but not limited to devices, equipments, upgrades, and other items. There's a 3-year retention of gift documentation requirement, but otherwise the healthcare provider can accept gifted services or equipments as part of this application process. So the online portal for applying to the telehealth program has already been made available by the FCC at the Keep Americans Connected page, which you can find on the landing page of the FCC's website. And there are helpful instructions provided to applicants about how to fill out the application. But generally, as expected, you'll be filling out applicant information, contact information, the healthcare provider's information, the type of services to be provided through the use of the fund, as well as the type of conditions that will be treated. There are also other fields that the applicant will need to be filling in that describes the goals and the objectives for the use of the fund, the timeline for deploying the services and the devices, other factors or metrics that can be used to help measure the impact of the funding, how COVID-19 has affected healthcare providers in your area, and information about geographic area and population served, and then the targeting of any high risk and vulnerable patients. Those are all plus factors that will help get your application approved. The applications will need to list out separately the requested funding amount for the devices. And finally, there should be supporting documentation that summarize expected costs, including invoices or quotes from a vendor or service provider that's specific enough to identify line items, description of the service or devices, the eligibility category, the quantity, and the upfront and recurring costs. Finally, the applications need to be filed with the FCC's ECFS system. And as part of the application process, the entities applying need to also certify that they are observing certain privacy practices, and this is where I turn to Dwayne.
Great. Thanks a lot, Sean. That's a good transition. So I want to talk a little about some of the privacy implications and considerations that are here as telehealth expands, both in terms of the FCC program and more broadly looking to the future. I think a key part of telehealth adoption in the long term will be establishing trust with patients so that they have an understanding that their sensitive health information is being kept private and secure. So in addition to the regulatory considerations that I want to talk about, I think it's also important to think about the best practices for ensuring that patient confidentiality is kept and use of these new technologies doesn't compromise any of the privacy or security of this sensitive information. So I'm going to go through at a pretty high level the applicable privacy laws, the agency activities to watch, and then some key considerations. As folks who are well-versed in the space know, it's complicated, and the rules that apply, particularly under HIPAA, are quite complicated. But I think it's helpful, especially looking forward and looking at how the technology is going to develop, to provide an overview of places to look as this expands. The biggest privacy law in this area is the Health Insurance Portability and Accountability Act, or HIPAA, the privacy rule. The HIPAA privacy rule establishes national standards to protect individual medical records and other personal health information. It applies to health plans, healthcare clearinghouses, and healthcare providers that conduct certain healthcare transactions electronically. Generally, it requires appropriate safeguards to protect the privacy of personal health information, and it sets limits and conditions on uses of disclosure of it without authorization. It also requires that one of those covered entities obtain satisfactory assurances from its business associates that the business associates will appropriately safeguard the protected health information. This must be done in a written form, generally through a contract or a business associate agreement. There's also the HIPAA security rule, which requires covered entities to use appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of the electronically protected health information. So all of these come into play when you're talking about remote telehealth and communicating over certain kinds of technology with the patients. There are other laws outside of HIPAA that apply. HIPAA clearly, it applies to certain entities, as I just discussed, called generally referred to as covered entities, as well as their business associates. But, and it applies to certain kinds of protected health information. But on top of, in addition to HIPAA, there are a range of privacy laws that can apply if, for example, it's an entity that's not covered under HIPAA, or if it's medical information that's not itself covered under HIPAA, or just even on top of it. So, for example, there are a number of state laws that apply. That's sort of a case-by-case basis. And the Federal Trade Commission has indicated that even if you comply with HIPAA, companies need to make sure they're not engaging in unfair or deceptive acts or practices, which they enforce under the FTC Act. The FTC Act prohibits, for example, misleading consumers about how information will be shared. So agency activities to watch, the Department of Health and Human Services is primarily responsible for enforcing HIPAA. During the COVID-19 national emergency, they have announced that HIPAA rules have been, are not going to be, they're going to exercise their discretion not to enforce certain HIPAA rules as to healthcare providers who use telehealth services in good faith. So this is an important point because as telehealth services expand, you want to make sure that you're using communication services that are not prohibited underneath the HIPAA rules. So the kinds of things that they talk about being acceptable include Apple FaceTime, Facebook Messenger, Google Hangout, Zoom, or Skype. On the flip side, services like Facebook Live, TikTok, or Twitch, which is a video gaming platform, are the kinds of publicly accessible options that should not be used for telehealth. So some additional clarification there has been very helpful. Additionally, the FCC plays a key role in placing conditions as it distributes funding. And as I just mentioned, FTC authority would apply. They have the ability to scrutinize any sort of issues that occur. One thing the FTC has emphasized is when using video conferencing services, to take extra steps to do what you can to ensure their confidentiality. So even something like Zoom can have different security settings, and there can be certain steps that folks can take in order to increase the security, such as only letting trusted people in, using different codes for each different meeting, and not using codes over and over again to protect privacy and confidentiality. All right, next slide. So some key considerations to think about. The first one, as I just mentioned, is video conferencing software, which ones you use and the potential limitations on it, in addition to taking certain steps in order to determine whether or not something is sufficiently private and is protecting patients' medical record confidentiality. I think it's also important to think about ways in which you can warn or let patients know the limitations of what they're doing. So for example, encouraging them not to be in public when they're receiving their consultations, having an understanding and limitations of software. It's important to look at the software itself and determine whether or not, via its privacy policy, it is sharing certain kinds of information with third parties, which is something that has come up with different kinds of video conferencing software. And then also just to have an understanding of whether or not that video conferencing software attempts to be HIPAA compliant. As I spoke about a second ago, HHS has announced that they will exercise their enforcement discretion as to use of certain kinds of video conferencing for health providers. But that's complicated. There's a lot of, the devil's in the detail. There's a lot of rules there. There are also some video conferencing services that have attempted to become HIPAA compliant or say that they are, and who have also agreed to enter into business associate agreements with covered entities. So that's another option to consider if you're thinking about that from the perspective of using a HIPAA compliant service, particularly if you're thinking about telehealth going forward past the COVID-19 emergency, because those rules that sort of relax the HIPAA standards for video conferencing are not necessarily going to last forever. They are appear to be limited to the COVID-19 national emergency. So for long-term, thinking long-term, the choice of video conferencing and privacy and cybersecurity around the system that you use and build in, and having those right contractual agreements is going to be very important. The second thing is cybersecurity threats. This is a particular issue, again, with video conferencing software. As more and more people do remote work, there's been more a step up in phishing attacks or other sorts of targeted attempts by fraudsters to get into these video conferencing and steal sensitive information. Basically, you want to make sure that in terms of an incident response plan or a cybersecurity risk management plan, which companies generally should have, that when you're looking at telehealth and you're integrating increased video conferencing capabilities, that you have a good understanding of how to handle cyber risks and make sure you have things like adequate safeguards in place, the right management structure to identify those and respond to them if you do see some risks in there. The third piece is third-party oversight. Obviously, under the HIPAA rules, as I just discussed, there's pretty clear rules around sort of flow-down obligations to third parties that are business associates and that are service providers. But even outside of HIPAA, something at the FTC, where I used to work, something they have increasingly focused on when they look to see whether or not privacy is being protected is what are the oversight responsibilities and obligations of particular companies. So it is no longer the case really that a company can say, well, a third party service provider had access to this kind of private information and then they suffered a breach, but we're not responsible. That is increasingly looked at skeptically. And I think, in this ecosystem of telehealth where you have different technology providers, healthcare providers, others who might be involved, it's going to be a case where there is a privacy issue that comes out. Regulators will look closely to see what folks are doing to monitor their service providers to make sure privacy is protected. And the last thing I want to point out here is there are requirements and risks tied to receipt of government funds. So Sean mentioned that as part of the application process, there is a certification under the FCC. There's a certification that the company that's applying will follow all applicable HIPAA and other applicable privacy rules as they apply during COVID-19. In addition, there's a number of representations, that Sean talked about in terms of the need for it and, different certifications you're making for receipt of funding. All of that would ultimately fall under the False Claims Act, which essentially prohibits companies from submitting false claims to the government. So basically making any sort of misrepresentation in connection with government funding. So that is something always to keep in mind when you're looking at government funding. And I think in particular, it's something to keep in mind when you think about managing privacy and cybersecurity, because increasingly we have seen situations where False Claims Act investigations have occurred after there have been some sort of violations of privacy and cybersecurity on a theory that the person receiving government funds has made representations around it, but not followed through. Again, it's a great opportunity, but just another reason to reinforce why you want to be careful to make sure that confidentiality and privacy is protected there. Those are civil actions that are enforced by DOJ. They can also be enforced by private plaintiffs under this qui tam theory. And we did see actually after the last economic downturn in 2008, that there was a lot of interest from the government and a lot of investigations around false claims. So I think it's important to keep that in mind, including in the privacy context when looking at funding. So those are the overviews. As I said at the top, I think ultimately it's in everyone's interest to make sure that as telehealth expands, and now it's expanding very quickly, that these privacy concerns are kept in mind, both from a sort of in the weeds regulatory standpoint, but from a broader perspective of encouraging trust and adoption of the system itself. With that, I'll turn it back to Michelle.
Great. Well, thanks, Dwayne and Sean. We are close on time. There are a few more questions. I'm going to throw one question to each of you. And then our emails, as I mentioned earlier, are listed here. So feel free to email any of us directly. Also, as I mentioned, if you'd like to be added to the telehealth kind of toolkit distribution list, send me an email and we'll make sure to add you to that. But we're going to quickly get to two questions before we wrap up. So Sean, I'll throw you a quick question. Can a private for-profit hospital be eligible for the funding?
Thank you, Michelle. The answer is no. The eligibility criteria for participants of the telehealth program is pretty strict, and it's limited to nonprofit and public healthcare providers that fall within the 7 or 8 statutorily defined categories. So a for-profit hospital is not eligible to participate in the program.
Okay, great. And here's another question, maybe Dwayne, if you can take this one. How high of a priority do you think privacy compliance is going to be for regulators, especially given everything that's changing with the pandemic?
Yeah, my sense is that privacy compliance and enforcement will still be a pretty high priority for regulators. Even with all the disruptions that are being caused by COVID-19, you've already seen, sort of letters being sent out and statements being made suggesting that they're looking very closely at privacy matters as well. You can see through the steps that HHS has taken that there may be some leeway for good faith compliance, but at the same time, there's a concern particularly around health information that companies that are handling that take care to safeguard it.
Okay, great. Well, I think that's all of the questions that we have time for today. We do have a few more that we'll try to respond to directly. We thank you for joining us today. I know in the slides, there were several links, so you will be getting an email that has a copy not only of the slides and a recording of today's session, but also some live links to some of those resources that have been provided. Dwayne, Sean, and I hope you found today's discussion useful. We do hope to hear from you and keep in touch. This is a unique time and setting that we're all kind of living through and trying to navigate today. We, as I mentioned, do hope to host future webinars in coming weeks. So please do join us for those. And on behalf of the team at Signal and Wiley, we wish you all continued health and wellness. Take care, be safe, and thanks again for joining us today.